Good afternoon, everyone. My name is Sarah Barker, the founder of Connect Our Elders, and today I have Tammi Moses, the founder and chief encouragement officer of the Hoarding Solution. Thank you for joining us today, Tammi.
Hi, Sarah. Thank you so much for having me. I'm looking forward to talking with you.
It's our pleasure. I'm super excited about the information we're going to learn today because hoarding is a bigger issue than what a lot of people may think. I mean, they picture just, my grandmother saving a couple of TV dinner trays, right? But there's actually a lot of safety issues around that, and we'll get into that. Before we get started, though, I do want to inform our audience that this particular podcast is even more special for me because Tammi is also a veteran. She was a Navy veteran. Would you mind telling us a little bit about that experience, Tammi, before we get into the hoarding solution?
I was very happy to join the Navy, actually. And for me personally, I was looking for a way to travel and do some things like as a young adult. And that really is what drove me to look at what are my options. And through that process, I was able to travel, and I was stationed on Guam and on a ship there. And I got to do a lot of things and see a lot of places I probably wouldn't have gotten to do had I not made that decision as a teenager. So it definitely a good one. And I know sometimes people struggle with seeing their kids make that kind of decision, but it was the best one for me, and it's led me to so many other people and connections that I never expected. And so
yeah, I can relate with that. I came from a town and an upbringing where there really wasn't a whole lot of opportunity at least that I could see for myself other than the military. So the military really changed, I think, the outcome of my life. So thank you for your service. Now, so the name of your company is called the Hoarding Solution. So that seems, pretty self-explanatory, but it's a very, very dynamic issue. So let's get started with learning about this. What is hoarding, and how is trauma involved in hoarding?
So hoarding itself finally has its own diagnosis, which it did not for a very long time. And it's basically the inability to discard items. Or if you are in a position to discard them, it's a very stressful situation for that person. And it's very hard to make a decision. And that's part of what the problem is. Making a decision means you might lose out on something. And I have found that trauma is so much the underlying reason why people hoard. And it's usually something that is not addressed, and it kind of festers, if you will, until it reaches a boiling point. And so many people I have worked with have shared their story, and it's part of the process. That sharing that story seems to help people release their things. But there's a lot of people who dealt with a lot of lack. There's people that had unspeakable things happen to them as children. There are people who landed in the foster care system for some reason. There are people who ran away from home because of chaotic situations. And we tend to kind of repeat that behavior, and I see that trauma just continuing, and we make more choices that continue our trauma instead of dealing with it.
And would you say that in our elderly population specifically, right? Because that's often where I have seen hoarding situations. And so, it's sad to think that individual has been carrying the trauma their entire lives. I mean, all the way into their 80s, because what I hear you saying is that one of the causes behind hoarding is something traumatic that happened in life, And so is hoarding a way where people feel a sense of control, a sense of power, that makes them, that's their way of dealing with the trauma? Is that what it's about?
I do definitely see that piece of it. And oftentimes you didn't feel in control when you were younger, and so now you do have some control over your space and over what you want to keep or not keep. And yes, it is definitely a form of control, and it's also a form of protection. Like the more stuff you have, the less likely people will be able to access and hurt you, type of thing. And so it's like a protective measure. And a lot of times you may have grown up without shoes or shoes without holes. Or you may have grown up without a good amount of food. You may have had a lot of lack in your life. And that's what I see coming up for people, especially with the elderly and the older folks who, if you look at that age group and you right now, and you look at World War II, you look at Vietnam, you look at Korea, you look at the loss of life that came through those things, you look at the fact that they may have lost a child, they may have been through a divorce, or
Yeah.
there's just so many layers for someone to deal with. And often a person who is younger maybe have the mobility to move through their space and all that. But as we age, it's much harder to move boxes. It's much harder to pick up that washcloth that fell on the floor. And a lot of times the people that hoard won't let you in. And so you may not know how bad it is until there's a crisis point where it's a fall or the EMS needs to get in.
Right, right. That's so true. And we'll get more specifically onto that issue, the safety around it. Why is it that you talk about hoarding? We talked about this when we first met, and so I think I know the answer, but I'm excited for our audience to hear this. So why is it that you talk about hoarding?
Initially, it was not something I thought I would be talking about publicly. It was a large reason why I joined the military, because I wanted to get away from growing up in that environment. And a lot of people have like the hoarding shows as a frame of reference. And I will say that that is definitely true. In a lot of cases, it really is that extreme. At the time I was growing up, it wasn't quite that bad. And but I didn't know it was like a thing. Like people would say, why don't you clean it up? Well, I'm 12. Like, how am I supposed to do something about this? And the expectation that I would fix it, I think, is what really was like, it always was over my head. And so I felt like the only way to get out of there or to get away from that was to get out of there. Thus,
I'm sure there was some shame too. I mean, as a child, do you want to talk a little bit about that?
there was this shame piece for something like you didn't create. So it was very weird to be like responsible, yet you're not. Like, and if you moved something, that was the crisis. Like if moving it was the issue. So you learn to not move things. You learn to just navigate through so you didn't cause drama. And I think I really took on that role of peacekeeper, like, oh, I'm going to make a meal or I'm going to do this. And so, but in doing that, I pushed away who I really was, which was, what the hell is going on? And why can't I fix it?
Right, right.
And you don't want to invite people in. It stunts your growth, I think, in that connecting with people. Although we did have people over, I got to a point where I wouldn't invite my friends over because I'm like, they don't live this way. And I don't like that we live this way. So I'm not inviting them in anymore.
So take that situation that you're describing, right, as a child and how it impacted you. It makes me question how many of the elders that we have in society where it just gets to the point where they've accumulated so much stuff. But as you were mentioning earlier, physically it gets more difficult to move boxes, to, pick up the washcloth off the floor, like you were saying. So I wonder how much that contributes to the isolation, because even if they did have somebody want to come visit, I wonder if the fact that they find themselves in that hoarding situation, makes them not allow people in. Just as a child doesn't want to allow somebody in, I wonder if that same thing is happening with our elders.
I do see that a lot with our elders and with people dealing with long-term health issues like cancer or dialysis or things like that. And like they may have maintained at a certain point and now they can't anymore. And I would say it does increase isolation because often the person that has a hoarding issue, they will say, I don't have an issue. But I think most of the time, in the back of their head, they're like, yeah, maybe I do. But who would I call and how would I get help? And so it really does limit you from inviting people in for coffee, or just if someone drops by, you like step out on the porch instead of letting them in. And so there's like this, you keep up a wall, this barrier, so that people don't know what's really going on. And the other reason people do that, though, is they don't want to be judged. They don't want to be evicted. They don't want to be told what to do in their space. And so there's like, it's an avoidance technique. Even if your house is pristine, which my house is not most of the time, but you still have this fear like someone's going to come in and see that one dust bunny you didn't get. But that's very normal for a lot of people, I think. Like, you're worried you're going to be judged for your environment. And it's even worse if you have a hoarding issue. And if Aunt Betty isn't letting you in, like, repeatedly, and you've never been in, or it's been 10 years, I'd start to wonder what's happening. You know, what's going on in her space if you can't tell. Often you can tell from the outside, but sometimes you can't.
Right. That's a good point. Well, thank you for sharing with all of us, your very personal, vulnerable story about why this is an important topic that you discuss. So, why, as a society, should we be concerned with this issue?
Well, I am starting to call it a public health crisis because it happens so often behind closed doors, and then we don't know that it's a problem in it sometimes. And part of the reason why it's important to address this is there are an estimated 15 million people in the USA alone that have a hoarding issue. And that is thought to be a low number because a lot of people don't report that they have this hoarding issue.
How many people?
15 million people in the US alone. Other countries like the UK and Australia have similar numbers in that it's about 3 to 5% of the population that's struggling with it. And say, for example, you have a 30-unit apartment complex and one person in there has a hoarding issue. But say the property management doesn't know that yet. But they walk through and they do an inspection and they go through 5 houses and then they get to the 6th one and they're like, what is this? Like, how is Betty living in this apartment? Like, there's no room for a person. And so depending on what's going on in that space, if it's just clutter and it has a smell, you might be able to deal with that. But what if it's clutter and a smell and an infestation of some kind? So now you're impacting that unit plus any surrounding units. So it's a bigger issue at play than, they just, Louis lives over there and his property's just, he has 57 cars, and it's, the dynamic changes also if you are, say, in an apartment versus, 5 acres. So the impact you can have on other people can be much broader, and which brings in the fire aspect as well. Heavy clutter can increase your fire risks as well as fall risks, and stuff can avalanche. I've seen it where it just, and now it's a trip hazard. So as a society, it is a public health issue that needs to be talked about more, needs to be more awareness in that arena.
Yeah, I couldn't agree more with you. I know I am familiar with several professionals that will help in hoarding situations, but I've never heard anybody speaking publicly about it as the very real issue it is. So I'm really, really happy to have you on here today. Let's talk about, so when there is a hoarding issue, and I've dealt with the adult children of some elderly clients I've had, and everybody tries different approaches. You have the child who says, oh, I just keep trying to ask my mom, to get rid of stuff and she won't. And then you might have the adult daughter that just decides, hey, we're doing this. Like, I'm packing this stuff up and I'm throwing it away. So that leads me to my next question for you. Why are forced cleanouts harmful?
Well, sometimes forced cleanouts are required, and that is generally because we haven't addressed it prior in any way. The reason it's harmful is most of us would not appreciate someone coming in and saying, you know what, today we're throwing out all your stuff. And so the stuff clouds the judgment of what's going on with that person. We stop seeing that there are multiple people being impacted. We just focus on, we're going to clean this space. And I'm not saying you don't have to do that sometimes, but what if we could do something and intervene earlier than that? And the reason it's harmful is that person's already had trauma, and now we're removing their protection, if you will, and now that's increasing trauma for them. They also don't get to have any say in what happens. We may not take into account that they might have $100 bills stuffed in all the books on their
That's my grandmother. You just described my grandmother right there. Money in the what were those books? The Harlequin romance books. So she would have the $20 bill stuck in those, or she had mason jars under the bed, money under the mattress. So that didn't even cross my mind.
And scoop it out. But it's also really time consuming to go through a bunch of stuff with someone who has a hard time releasing it, has a hard time understanding that the reason you're bringing this up is because you're concerned about them, not because you hate them. And there's often this connection like, well, you're telling me what to do because you hate me. And it's more like, no, I'm telling you I'm concerned because I love you. And I recognize that there's trauma and this is hard. However, you'll be evicted if we don't deal with this, that
right.
type of
or mom, you're gonna trip and fall and possibly break your hip, and then you're gonna end up in a skilled nursing facility, and who knows what's gonna happen after that. So, circling back to the safety issues, but from experience, I've found that regardless of the approach that the adult children try to take, it is most always met with absolute resistance. And so I feel like there's a huge need for people like you who can facilitate that conversation, because it's always different when it's coming from an outside person, especially a person who's an expert in the area. Would you like to elaborate on that?
So part of the reason it's hard is because you have this emotional connection, say, with your parent. You may also have your own trauma that you may have experienced if you grew up in that environment. If you haven't addressed your own issues, it's really hard to step in and help someone else address their issues. And so there's like this emotional baggage and component that is huge that we're dragging around. We may not know it. We also may be mad. We might be angry that we've tried to help, but they resist it and they don't want it and they don't see the problem. So all this emotional stuff is coming up, and often change doesn't happen unless there's outside force exerted, like a landlord or the county or something like that. So it's easier to say, hey, I know a person who specializes in this type of situation, and I'd like to bring them in to have a conversation about what we're concerned about. And I would say the key, whether you work with me or anyone, there are professional organizers that work on this type of thing. There are some other like junk removal and things who are familiar with hoarding, but it can be helpful to bring someone else in that doesn't have an emotional component to it. I care. I want to see the resolution a win-win for everyone as much as possible, but also I can kind of be the bad guy if that's what you need. Be like, and you can also join forces and say, we want to do this so you can stay in your apartment, Mom, because
right.
I want to go. And not to scare them so much as, look, this is what's going to go down if we don't start talking about this and addressing the issue.
Right. And I think that using a professional such as yourself, not only to broach the conversation, but to facilitate the first steps moving forward with, starting to get rid of different items that maybe aren't needed. Yeah, and I think that you're especially unique and differentiated from other professional organizers because you are so heavily focused on the trauma aspect of it. And I can definitely see that relation between the hoarding and then the trauma, from years ago, or it could be even trauma in adult life. So you're definitely unique in your approach. Now, how can we start a conversation with a friend or a loved one that struggles with a hoarding issue? What are some tips to start delicately beginning those conversations?
So if you're in a position where that person trusts you and they let you in their space, or they might reveal a little bit about what's happening, I would say one of the first things you can do is listen to what they're telling you. Don't assume that you know why they're hoarding or how it all of a sudden started. If you start just talking to them, you will, in general, learn a little bit about their story. And I would say, as much as possible, be respectful of their space, of their wishes in the beginning. I would suggest talking about your safety concerns. Look, I'm really concerned about the fact that there are 10 years worth of newspapers in your bathtub, and I know that means you can't use your shower. So I'm concerned that you aren't able to meet your daily needs, basically. Or you could say, I'm worried about the fact that in 2 months you're going to have this surgery and you're going to need to come home. And how are you going to do that? Because you can't walk through your space right now. How are you going to do that if you have a walker or a wheelchair? How
Mm-hmm.
will you recover in this space if we can't have home health come in? And so I think it needs to be really practical conversations, and don't try not to be judgmental and try not to blame them or shame them. It's really hard to do that, especially if you're angry. So you have to kind of check yourself when you go into that conversation. But I think being very focused on the person. Granted, you will see the stuff, but we all see the stuff, like, except the person that hoards.
Right.
There's clutter blindness, like they really call it that.
I
Because
was just about to ask you, I mean, is that a real thing where it really is as if they don't see all the stuff, or they don't realize they really have as much stuff as they do?
yes, the term they use is clutter blindness, and I've seen some of the studies that show in your brain chemistry and your brain makeup, your brain is different in how you're seeing it. And you're just like able to shut it off. Like you can't actually see it. And or you are put your blinders on. So it's like you know it's there, but you don't let it bother you. Versus someone like me, who I find it extremely distracting.
Right. That's really fascinating how the brain can do that. That's super fascinating. What can various industries do to begin intervening earlier? So rather than waiting until it gets to a point of crisis, what can the various industries, such as home care, home health, any other industries that you can think of, what can they do to start intervening sooner?
I think we need to be asking more questions sooner. So, say for example, you're doing the home health and you go out to the home and you do your assessment, and you may walk into it not realizing what you're walking into. And part of that is, what is your response to that? Because however you respond is going to set the tone about whether or not that person's going to talk to you, let you in the door, consider any options that you're offering. But I would say do not be silent, like, because that's what's perpetuating the problem is, oh, Betty's going to clean that up. No, probably not. And
Yeah.
part of it, people will say, oh, well, I'm going to be back in 10 days and I want X, Y, and Z done. But then you leave and there's no guidance. You don't tell them, I want to see a 36-inch path. We need to get from the door to the stove. We need 2 feet on either side of the stove. And so having those conversations is definitely a starting point. Lots of industries, like someone might have a fridge that breaks and then they're too embarrassed to have someone come in and fix it or look at it. So now they have no refrigeration and rotting food. So there's a lot of industries that might come across this, and they aren't, some people won't go in the house if it's that extreme, which I understand. Other people will, and then they may or may not be able to help because that person will say, well, I'm not getting rid of this fridge. I don't care if it's broken.
So Tammi, what is, because as you're describing this, I'm thinking, there's been situations where the hoarding has been extreme, and the go-to solution has been for APS to be called Adult Protective Services. But is that really a situation where that needs to happen immediately, or could whoever the provider is that recognized the issue maybe bring somebody like you in first, or at least try that option before turning the person over to APS?
So I believe that's part of the reason why we need to talk about it earlier. So let's say you're a property manager and you walk through and you see this and you're like, okay, this is not good. And your first thought may not be to actually call APS. You might be calling that adult kid or that emergency contact and saying, hey, we have a problem over here. And so often that can be a way to kind of start addressing the issue, because frankly, there's a lot of us that think, I did for many years, that you call Adult Protective Services and they're going to step in and do something. Well, technically no, because if they determine that that person is competent and happy where they are, they won't necessarily intervene. They might offer some other services, but they aren't going to necessarily solve the problem. And if you're looking to solve the problem, you need to look at other options. And it could be you call that adult kid. It could be you talk to your tenant and say, look, we really have to deal with this. We need to talk about what's going on here. And, these are some steps that we can take. And if you're not prepared to do that, it can be a great option to say, look, I know a person that I'd like you to talk with. They do consultations. They can talk to you about what's going on and create a plan so we can start addressing this. So it's very important to figure out what's your end goal. And you might need to talk to that person, because is your end goal to just get their space safe so they can continue renting? Or is your end goal that they're downsizing to move to, say, assisted living? Are they trying to sell the home? Or are they trying to age in place? And age in place is great if you're in an environment that you're safe to do that. But if you're not, then you need to be having these hard conversations. And in general, like you mentioned, that person is going to resist. They're going to be angry. They aren't going to be very receptive to what you say in general. Although there are times when some people are like, I'm done. I don't know what to do. I'm overwhelmed. I'd like to stay here, but I need help. And it's easier to help someone who's in that space, but often they aren't. And I would say maybe your objective is to help them get to a place where they understand, this is why we're taking these actions. This is why we're saying we're concerned. And this is what we would like to do to help you get this straightened out. And I think you have to step back for sometimes and look at, if you weren't dealing with the junk at all, how would you deal with the person? Like, just separate it and look at what can you do. But
So remove the judgment from it, or even the perception that there's judgment, and really, come from a place of I care about you and I really want to help you. So they don't feel attacked, right? Because nobody's going to be open to a conversation if they're feeling attacked.
And the attack, that's a good word, because usually that's kind of how you feel if someone is telling you what to do and not considering, like, a lot of these people are brilliant people. They had excellent careers. They might have served for years in the military. They are not dumb people. They're not messy people. They're not slobs, if you will. And that's a lot of the perception. If you're listening to people who don't understand what's going on, that's a lot of the words they're using. Or the other part is, don't walk in there and say, oh, today we're here to throw it all away. Like, that's a trigger. Like, and it's, if you think about it, it's pretty disrespectful, no matter what the conditions are. So getting to a place where you're respectful of that person and their wishes, because honestly, you could probably honor some of them. Like, maybe they don't need 9,000 romance books, but maybe they want to keep 100. Maybe that's okay,
Right.
And I think sometimes we want to step in and take control because we see that's what needs to happen. And I totally understand that. But like this past weekend, I had an amazing conversation with someone who has a hoarding issue. And the fact that everyone involved walked away going, wow, that was a pretty amazing conversation. That I was like, oh, okay. This is my theory, that listening to every perspective, it is valuable, and every person feels heard. You don't have to agree, but you can hear them out. And
everybody wants to be heard. I always say that. It's a respect thing. It's a consideration thing.
And when you look at the idea that you're supposed to honor your father and your mother, like from a very biblical perspective, granted, that's easier to do if you get along with them, but even if you don't, you can still bring pieces of that into what you're trying to do. And if you're dealing with a parent that's aging, who is like, okay, I want to do this, and I want to go to assisted living, I want to go to an easier place for me to live, and they're on board with all that, it's way easier. But if you have an elderly parent that hoards, it's a whole different ballgame. Like, you have so many other layers of the onion to unpeel to get to what's going on. But I honestly believe that once we're heard, and we know we're heard, we're more willing to hear what you might have to say.
Oh, absolutely. Absolutely.
I'm that way. Like, oh, you heard what I said. Wow. Okay.
Yeah.
Hear the next thing I say.
And
valuing that connection, I think, is a way to create relational space. You're not railroading them. You're actually having a conversation. I will say, though, that sometimes you can have anxiety, depression. Sometimes dementia shows up. It starts to show up. And that's when it gets really hard to figure out how to resolve it. And I think you have to go into it thinking, what's the best outcome for everyone that right now? And what does this person need right now? And sometimes, honestly, the clean out isn't the priority. Sometimes it's a UTI. Sometimes it's that surgery. Sometimes it's they need new glasses. They might need a ride to the store. I mean, there's just all these other ways that we could help and intervene and start the conversation before we just pounce and say, okay, today everything's going to the dump. Like,
right. And I'm a big advocate of proactive conversations, right? Don't wait till the last minute, to explore your caregiving options. Don't wait till the last minute to explore your hoarding solutions options, right? Like, so if you're an adult daughter, adult son out there, or, you work in the elder care industry, if you're coming across these situations, be willing to bring it up in a tactful way, or just say, hey, I have somebody that I think you'd be interested in speaking to, and so with that, Tammi, if people are out and about and they're meeting with people in their home and they're identifying, or if their friend says to them, "Oh, I'm just so overwhelmed with all this junk, I don't know what to do," how can people reach you?
So there's a couple different options. My phone number is 360-720-8401, and people can call or text on that. My email is thehoardingsolution@gmail.com. And I'm happy to throw a few ideas out there and schedule a consultation. And the virtual world makes it pretty much, we can connect in so many ways that and we can figure out a time that works. We could have that initial conversation. We could bring the person that hoards into it, and there's ways for us to connect and talk about it. I'm also at the Hoarding Solution on Instagram and on Facebook. And I also have a group called the Hoarding Solution Group. Well, I'm going to start calling it a community, because there's so many industries that come in across this and are like, they're flabbergasted. And I want people to have a connecting place where we're talking about the work they do and what's needed and how we can shift this conversation, because it's very sporadic. There's connections all over the place, but we're not all aligned. And
we're not collaborating effectively.
And similar to what you're doing, like, you're trying to get all these resources together for the elders and the people who are helping the elders. Like, how do you find that space where all that stuff is? And that's what people need. And I have a website too called homesareforliving.com, and I have a blog there too where I blog about a lot of this, because sometimes you maybe don't want to talk to me, but you might get a one little nugget and be like, tomorrow I'm talking to mom.
Yes, and that would be a good place to start. And you said it's homesareforliving.com?
Yes.
Okay, wonderful. And I also think, so as far as, bringing the solutions together, having these proactive conversations, I've noticed over the years that lots of times, like, here's an example. If somebody works in non-medical home care, when they're doing a consultation, that's all they're thinking about is their area of expertise. Same thing with home health, same thing, let's say, with, I don't know, a hospice personnel that's in there. But I've always been a believer that we really need to be looking at the whole picture, regardless of which part of the industry we specifically represent, because we can bring in the appropriate resources to help the person in a more holistic way if we're willing to open our eyes to the whole situation. I think that's so important to collaborate with other resources, in the mission of helping our elders. It's super important, because these situations are not typically a situation where it just requires one resource. It's often the overlapping of many resources to ensure that they're safe and to ensure that they have a high quality of life. So I absolutely love what you're doing, and I love your approach to it. So anybody in the audience listening, if you know somebody, if you happen to come across it in your line of work, reach out to Tammi. I will be providing her information when I repost this as a YouTube video. Again, my name is Sarah, and I'm the founder of Connect Our Elders. My entire intent is to empower the aging process through providing education around resources, navigation through the resources, and ongoing advocacy. So Tammi, thank you so much for being our guest today.
Thank you so much. I appreciate it. And I totally agree that holistic approach is what we need to be doing for our elders, for our people that really need our help.
Absolutely. Thank you so much, and have a good day, everyone.